News Desk. With just 11 days to the lapse of the restriction to stop the spread of the coronavirus, President Uhuru Kenyatta now says the decision to reopen the country lies with the country's ability to respond to the surge in the number of infections. NTV with the report.
As the number of infections race towards a peak, the head of state is weighing in on what the future looks like and the delicate decisions he has to make.
County governments and their readiness to respond to new imported cases of infection will also equally largely determine our national readiness to reopen the country as a whole.
The Council of Governors says the movement restrictions should not be lifted unless the proposed strategies to enhance testing and screening at county boundaries, contact tracing are adequately implemented. They also want the curfew in place for as long as it takes to flatten the curve. So far, only 12 counties have attained isolation facilities with a 300-bed capacity. 34 counties are working to put in place the facilities before the 30-day period lapses. However, 16,914 health personnel had been trained on COVID-19 management, among them 59,449 community health volunteers.
They're able to work as monitors and evaluators of our home-based care program.
COG is banking on 4.6 billion shillings, which it is asking national government to release under the devolution support program. And while both tiers of government fight on one front, those on the front lines are fighting other battles in their minds as the pandemic takes an emotional toll. For over 3 months now, healthcare workers across the country have been taking care of the health needs of various COVID-19 patients within this country. But at the moment, the ministry now says it is important to take care of them for them to help others.
Doctors, nurses, lab people, they also cry. They feel pain.
The healthcare workers can now call and speak to a mental health specialist. The call service will be available 24 hours a day.
We have people across the country, actually in 45 counties, that can be called upon to be able to provide the psychosocial support.
Leila Mohammed.
Sirisia MP John Waluke is to pay 727 million fine or serve a 7 years jail term. He was charged with fraud in case involving the National Cereals and Produce Board and companies, Chelsea Freight. Citizen with more details.
The Sirisia legislator made his entry into the courtroom a forlorn figure in total contrast from the usual charisma of the Jubilee legislator. He had been in custody for 3 nights and came for a date with fate. Joining his co-accused in the convicts bench, 79-year-old Grace Wahungu, with whom they have been found guilty of defrauding the National Cereals and Produce Board of amounts totaling to 313 million shillings using a company they are directors of Erad Supplies and General Contracts Limited. And even though their lawyers spent the afternoon pleading for mercy and leniency on the side of Chief Magistrate Elizabeth Juma, it fell on deaf ears as she stuck to the law.
We urge the court to kindly consider and exercise discretion in the favor of the second accused for purposes of enabling him to conclude his term in Parliament and also roll out the aid to the many who depend on him.
You have been told that the second accused is likely to lose his seat of Parliament. So what? There are many other people in Sirisia who qualify to hold that seat.
Under count number 3, where the two are accused of defrauding NCPB 297 million shillings, each of them has been fined double the amount, that is 594 million shillings, as mandatory fine, failure to which they face imprisonment for 7 years. This on top of 500,000 shillings as fine for the offence, failure to which they face imprisonment for 3 years. Erad Limited, the company that the two are co-directors, has been fined an equal amount, but to be paid by the two or face 7 years imprisonment. and for defrauding the NCPB up to 13.3 million shillings, the two face similar predicament. A fine of 500,000 shillings for the offence and then double the amount as mandatory fines, meaning Waluke will have to pay 26.7 million shillings and on top of that pay half of the fine levied on his company, that is 13.3 million shillings. The other half is to be paid by Grace Wahungu. They are also accused of defrauding NCPB of $24,000. For that, a fine of 500,000 shillings has been charged. On top of it, they are to pay a mandatory fine of double the loot, meaning $48,000. And that's not all. Ered Limited has similar fines to be shared between the two. Upon conversion, the stolen dollars will attract 7.6 million shillings in fines against each of the two. John Waluke is further accused of taking a personal benefit of 50 million shillings. For that, he is required to pay a mandatory fine of double the amount, 100 million shillings. Wahungu is accused of drawing a personal benefit of 40 million shillings, her mandatory fine being double the amount, 80 million shillings. But Wahungu was separately found guilty of uttering false documents and perjury, each of the two offences attracting a fine of 100,000 shillings or imprisonment for 1 year. In total, the Sirisia Member of Parliament may have to part with at least 1.04 billion shillings to secure his freedom. If not, he could serve a jail term for at least 7 years until 2027. For Grace Wahungu, she may have to spend time in jail for a similar period or part with 1.02 billion shillings. A fraudulent business worth 313 million shillings may cost the two a total of more than 2 billion shillings financially, but it may also cost a second-term Member of Parliament his seat.
And the second accused being a public officer, the conviction to be served the Speaker of National Assembly and the Parliamentary Service Commission for purposes of compliance of Section 63, one, pending any outcome of any appeals.
The two can, however, appeal the decision in 14 days' time. For now, they remain in custody. Sam Ke.26 TV, Nairobi.
The Senate committee has cleared Kirinyaga Governor Ann Waiguru of accusation laid against her by the county assembly. The governor, who was accused of abuse of office and misappropriation of funds. KTN with the details.
For the resumption of proceedings of this special sitting, I believe that you have now had opportunity to go through the report of the Special Committee on the proposed removal from office by impeachment of the Governor of Kirinyaga County. As you may have noticed, the committee has found all the allegations against the Governor not to have been substantiated. Consequently, Honorable Senators, the procedure to be followed in this case is set out at Section 33(6)(a) of the County Government Act and Standing Order number 75(4)(a), both of which provide as follows. If the Special Committee reports that the particulars of any allegation against the Governor have not been substantiated, further proceedings shall not be taken under this section in respect of that allegation. Honorable Senators, that being the case, this matter stands concluded and no further proceedings shall be taken thereof. However, pursuant to Standing Order number 1, and cognizant that consideration of the proposed removal from office of a governor by impeachment is one of the most important functions of the Senate under the Constitution, I shall allow the chairperson of the Special Committee to make brief remarks on the process undertaken by the committee and, in particular, any recommendations the committee would wish to make. The chairperson will have not more than 15 minutes. Thereafter, I shall allow senators to make general comments and observations thereon for not more than 30 minutes, after which the Senate shall adjourn. I thank you. Sure.
Thank you, Mr. Speaker. Mr. Speaker, this is a very interesting day. Ironically, Mr. Speaker,
What's your point of order? And when you want your point of order, just use the button, because I can see from here. Okay, Mazayo. Okay, Senator Mazayo.
Mr. Speaker, thank you very much for allowing me to interrupt my brother. The point is, I was one of the participants in this committee, and I know how detailed that report is. I think 15 minutes may be a little bit short for purposes of expounding on how certain decisions have been arrived at. If at all, Mr. Speaker, I think my learned colleague is very much aware about point of orders. What I'm trying to suggest here is, if he can be given at least half an hour, then I believe he will be in a position to put a little bit of some meat of each and every decision that was arrived at. And it's good for the country, because the country at this moment is watching. Thank you, Mr. Speaker.
In fact, there were 10 minutes. I added 5 to make it 15, because you'll have an opportunity to read the report, which is already done. So, okay, Chair, proceed.
Thank you, Mr. Speaker. I'm well guided. I will try within my ability to utilize the 15 minutes. Where need be, I will come back to your Honorable Chair and ask for extension of time. Otherwise, I thank you for this opportunity, Mr. Speaker. Mr. Speaker, this is a very interesting day. Mr. Speaker, as I was presiding over the proposed impeachment of Governor Ann Waiguru, some funny people were hiding in some cocoon, planning to remove me.
Order, Senator Malala.
As Senator for Kakamega.
Order, Senator.
It is quite ironical.
No, order. Can you use your time properly?
Thank you.
You are now dragging the House into your party issues, and we are not party to that. Please focus on your
Thank
report.
you. I want to remind the people that I am the Senator for Kakamega, and I'll stay to be the Senator for Kakamega. Mr. Speaker, sir, permit me to begin by remarks conveying on behalf of honorable senators of the Special Committee on the proposed removal from office of the Governor for Kirinyaga County, our appreciation and gratitude to you and this Honorable House for the confidence you expressed in us to undertake the honors task by appointing us to serve in this special committee. Mr. Speaker, pursuant to Section 33(3)(b) of the County Government Act of 2012 and Standing Order number 75(1)(b) of the Senate may, by resolution, appoint a special committee comprising 11 of its members to investigate the matter or investigate the matter in plenary. Mr. Speaker, the Senate Majority Leader moved a motion on Tuesday, 16th June 2020, and following the debate in the House, the Senate resolved to establish a special committee comprising of Senator Abshiro Alake, Senator Michael Mbito, Senator Mwangi Paul Githiomi, Senator Beth Mugo, Senator Anwar Loitiptip, Senator Philip Mpayae, Senator Cleophas Malala, Senator Beatrice Kwamboka, Senator Stuart Mazayo, Senator Judith Pareno, and Senator Moses Kajwang, to investigate the proposed removal from office by impeachment of the Governor of Kirinyaga County and to report to the Senate within 10 days pursuant to Standing Order 75(2) of its appointment on whether it finds the particulars of the allegations to have been substantiated or not. Mr. Speaker, following its establishment, the Senate committee held its first meeting on Wednesday, 17th, 2020, pursuant to Standing Order 193 and Rule 3A of Part 2 of the 5th schedule of the Senate Standing Orders. The Clerk of the Senate conducted the election for position of chairperson and vice chairperson. Mr. Speaker, I wish to report that the committee elected the Kakamega senator, the one Senator Cleophas Wahungu Malala as the chairperson, and Senator Abshiro Halaki, MP, as the vice chair. Mr. Speaker, sir, Section 33(5) of the County Government Act, Standing Order 75(3) and Rule 4A of Part 2 of the 5th schedule of the Senate Standing Orders provide that the governor shall have the right to appear and be represented before the special committee during investigation. Rule 4B of Part 2 of the 5th schedule to the Senate Standing Orders further accord the County Assembly the right to appear and be represented before the special committee. Mr. Speaker, the committee commenced its hearing on Wednesday, 24th, 2020, by convening a conference of parties where formal introductions of parties, recital of the mandate, and the committee adoption of the hearing program took place. Mr. Speaker, among the preliminary issues that the committee had to deliberate and make a decision on was a letter, Mr. Speaker, referenced Senate Letter 1/003 dated 20th June 2020 from the Speaker of the County Assembly of Kirinyaga requesting the special committee to summon Mr. Patrick Mugo, the Chief Officer, Finance and Economic Planning, Mr. Kennedy Ngiabi, the Chairperson, County Public Service Board, and Mr. Joseph Otieno Karilas, the Director, Supply Chain Management. The County Assembly stated in its letter that the said officer had refused, neglected, or otherwise been unable to give their statements and produce documents requested by the County Assembly. The committee deliberated on the matter and pursuant to Rule 9 of Part 2 of the 5th schedule of the Senate Standing Orders, issued invitation to appear as witnesses. The invitation to appear was served on the witnesses on the same day. Mr. Speaker, the County Assembly was represented by Mr. Ndegwa Njiru and Mr. Charles Mwangi Ndegwa, and the Governor was represented by Mr. Paul Nyamodi, Advocate, Mr. Kamotho Waiganjo, Advocate, and Andrew Muchiri Karani, Advocate, to appear on behalf of the Governor. During the...
thank you, Mr. Speaker. Point of order. Mr. Speaker, I didn't mean to interrupt Senator Malala, but to start with, Mr. Speaker, is making comments pursuant to your generosity and on application of Standing Order number 1. Ordinarily, we would not have gone this direction. The matter would have ended and we go home. And since he's doing so, you say that because of the importance of the impeachment of governor, I would suggest, Mr. Speaker, with your direction, that Senator Malala forgets about all this introduction, about who is a member of the committee, when did it start, who are the lawyers, who are the parties, and then go to the substratum, Mr. Speaker, the real issues that happen, so that then we can apply this short time, this window you've created, for purpose of the salient issues. Otherwise, his time will be wasted on things that we know. We know there is a governor, there was an MCA, there were lawyers, there was hearing, there was hardis. Let him just go to, this is the things the committee were faced as challenges, and they ended up making this recommendation because of this. That way, we'll use this time more quality than the recitals he's making. The rest we can read for ourselves.
Okay, Senator Malala.
Cabinet Secretary Professor George Magoha held a consultative meeting with the college principal at Kisumu Polytechnic. The meeting sought to discuss the NEC and CASNEB examination as well as measures to put on for the reopening and primary secondary schools. Citizen with more details.
While much effort has been given to primary and secondary schools as the government grapples with the reopening of learning institutions in the country amid the COVID-19 pandemic, there has been concern over the fate of close to 150,000 students in technical and vocational educational training centers. And the government is now giving this group the much needed attention. On Friday, Education CS Professor George Magoha is scheduled to meet principals in charge of TVETs in the country to deliberate on the framework to guide the process of reopening the middle-level colleges. Top of the agenda will be the CASNEB and NEC examinations, whose calendars have already been affected. NEC examinations were to be conducted in March, while the CASNEB examinations were scheduled to be done in May. The consultative meeting tomorrow expected to set and give the new dates for the examinations and whether they will be pushed to next year, as was the case for KCPE and KCSE candidates. The social distancing protocol that has remained a major nightmare to achieve in learning institutions ahead of the reopening will also be a key point, with sources revealing to Citizen TV that the ministry may consider resizing classes to ensure adherence, conducting classes in shifts and a staggered tuition arrangement so that each academic year uses facilities available on specific days also expected to come up, like the measures outlined for reopening of primary and secondary schools. TVETs will be required to have clean running water and soap for hand washing, sanitizers, adequate space for social distancing, and masks for learners and trainers, besides thermoguns for monitoring body temperature. Makori Ongechi, Citizen TV, Nairobi.
The Directorate of Criminal Investigation has instituted a parallel team of elite officers to unearth the recent multi-billion fake guns scandal involving the Ministry of Interior. The scandal involved lawyers Jacob Olo accused of conning the Mali Arms firm $7.5 million. NTV with more details.
The Directorate of Criminal Investigations has put together a team of elite officers to unravel a fake arms deal involving a firm in Mali, a lawyer, and dragging in the Ministry of Interior. NTV's Seth Olale reports that the ministry has since distanced itself from the scam.
No arrests have so far been made into the fake arms scandal involving lawyer Jacob Olo against Malian arms dealers and roping in the Ministry of Interior. The Directorate of Criminal Investigations has now set up an elite team drawn from the Special Crimes Unit and the Anti-Fraud Unit to spearhead the investigations that were being conducted by the DCIO Kasarani. The DCI was on Wednesday allowed to scrutinize the lawyer's bank account at the Gulf Africa Bank as investigators try to unravel the fraud. Detectives believe Olo, who is at the center of the fraud, received an initial payment of 7.5 million shillings that was supposed to be paid as commitment fees to enable Malian arms company called Premium Inter-Services get a tender to supply guns to the Ministry of Interior. Olo's law firm, known as Jacob Olo and Company Advocates, had in pro forma invoice, which we have since obtained, asked Premium Inter-Services to deposit $75,000 into its dollar account. When asked about the money, the lawyer, on initial questioning, alleged that the money was reversed immediately the transfer was initiated. Olo also alleges that he was only acting for clients who had approached him and had no prior knowledge of the kind of business they were involved in. The Ministry of Interior, however, says it is not aware of the deal involving the company based in Mali, Bamako, and which collapsed. Investigators are now looking for 4 other people who accompanied the lawyer to the Kasarani police station, saying they were members of the Witness Protection Agency. Seth Olale, NTV.
Due to pandemic, Kenyans are facing tough times as many are unable to pay rent and risk being evicted. KTN News with more details.
In Kayole's Patanisho area, we meet Dominic Angani, a father of 4 from Western Kenya who came to Nairobi seeking a better future for his family. A former security guard now reduced to looking for construction work in order to survive. The fortunes of the young family changed when companies laid off employees as a result of the COVID-19 pandemic. We find Dominic and his family in this bedsitter, a place they now call home. Like many other Kenyans who have been laid off, Dominic was evicted by his landlord from their 2-bedroom apartment, a situation made worse by his wife's ill health.
Kulipa rent ilikuja ikawa ngumu kwa maana wakati kazi inaisha na inapata sina chochote. So hakuna vile naweza kulipa rent, hizo pesa nimetumia kwa matibabu yake.
Since March, when he was laid off, Dominic has been dependent on construction jobs that get him around 500 shillings on a good day if he is lucky enough to land one. His former landlord could not understand his situation.
Kaniambia, wewe kitu ufanye na kupea time, utatoka uniachie nyumba yangu ibaki hivyo. Hata kama haitakaa bila mtu, acha ikae hivyo.
Some luck was on their side. The search for a new home led them to a landlord who agreed to let them move in on a condition that they pay up as their situation improves.
So alituruhusu tuingie kwa nyumba na tumlipe mwezi ya Julai.
At the moment, Dominic's dilemma is finding a job to pay what he owes the 2 landlords and to have enough to feed his family, who have now gotten used to going hungry on some nights.
Nakwambia daddy, mimi nasikia njaa, nataka chakula. Na saizi hauna namna yoyote mahali ambako unaweza toa. So inabidi unavumilia. Ndani yako kuna uchungu.
On the flip side of the coin, we meet Jessie Njeri in Nairobi's middle-class neighborhood of Donholm. Her life having been turned upside down after she was also sent home by her employer. Jerry, a single mother who worked as a mixologist in a local hotel, is now forced to stay home and seek other means of providing for her children. She has been reduced to a statistic of the job losses within the hotel industry. According to the Kenya Private Sector Alliance, 5.9 million direct and indirect jobs have been affected by coronavirus, with the travel and tourism sectors accounting for 3.1 million of the total job losses.
It's been tough for me during this period because kids won't understand when you tell them you don't have this. There is also issues with the rent.
She too has not been spared from paying her rent. So dire is Njeri's situation that she had to seek the help of the Landlords and Tenants Association of Kenya. Through the association, the landlord was stopped from harassing or victimizing Njeri or attempting to evict her from the premises. The landlord was further demanded to reconnect her water, which he had disconnected.
The deal is that I should pay him as soon as I get back to work, or I get away to pay him in bits until I finish.
For both Dominic and Njeri, their problems seem to have been postponed but are far from being solved. Their only hope is that COVID-19 restrictions be eased out and economic activities pick up soon.
Ningependa nisaidike, nipate kazi. Maana hiyo kazi itanisaidia, niweze kusomesha watoto wangu, niweze kuwalisha pia.
The president should open everything soon, because for me I think he should open and just let us take care of ourselves with all the precautions that we are given.
This is the grim reality of unemployment worsened by the COVID-19 pandemic. As others get the option of working from home, the likes of Dominic are simply home, clutching at hope that tomorrow will be better. Ashley Mazuri, KTN News.
To our business news, in just 2 days, the Global will be making the World Small and Medium-Sized Enterprise Day, at a time when the most small and medium business are struggling to cope with the COVID-19 shock. NTV with more details.
The outbreak of COVID-19 has impacted negatively on many businesses, forcing some to come up with creative ways of staying afloat.
Many small and medium-sized businesses are now investing in digital solutions to cope.
Since COVID-19 came, we've seen a significant reduction in sales.
Caroline Chebet, a cashier at one of the restaurants in Eldoret, answers a call from a client making inquiries about their products. The client made the inquiry after visiting their social media platform.
Our customers make phone calls and we deliver the products, or rather the food items, to their home.
And after making the payment electronically, the food is packed and given to a motorbike rider who embarks on a journey to deliver it. We followed up the rider along the way from the restaurant to the client's residence. 15 minutes later, we arrive at John Kennedy's residence in Elgon View Estate in Eldoret, a client who had placed an order.
I've received it. Iko vizuri sana. Nimeconfirm pia ni kitu nimeorder.
Sasa hata sisi kama wana boda boda imetusaidia ili tupate kazi hapo ndani.
Gabriel Kudaka, NTV.
To our international news, the NHS test and trace service is failing to reach 30% of people who test positive for COVID-19 in England. Referring to the Sky News, there are no translation service available despite the government's claim, which make it hard to reach people for whom English is not a first language. Statistics from the government show that the number of people successfully contracted has dropped since last week. Sky News with more details.
As England loosens lockdown, there's been a spate of coronavirus outbreaks in meat packing factories, like this one in West Yorkshire. They employ a high number of migrant workers. We've learned that the search for their contacts may have been hampered because government contact tracers weren't provided with translation services. We spoke to one contact tracer. His words are voiced by a producer.
Rough estimate, last 10 cases I've done, half were cases where English clearly wasn't their first language. It's Eastern European or South Asian languages, in the places that have been reported with factory outbreaks. This is an English-only service. The website is English only. There's no translation service. Unless you happen to get a random match between a case or a contact and a non-English speaking call handler, then you can't proceed, and ultimately that opportunity is likely to be lost.
The Department of Health and Social Care told us it was working on the website and said translation services are available for all contact tracers communicating with people who do not speak English. We put that to our contact tracer.
They haven't updated their official documentation. Right now, translation is not even an option on the system. It's brazen and bizarre that they have claimed it is.
Clearly, there were some moves afoot, because 24 hours after the government sent us its statement, this message appeared in a contact tracer Facebook group saying that translation services are now available and that it is limited for team leader use only, adding that this is completely new in just the past few hours. All this comes as the government's new figures for test and trace show the difficulty of reaching people. Between 11th and 18th of June, 6,923 people had their case transferred to the contact tracing system. Of these, 4,869 were reached and asked to provide details of recent close contacts. That's a bit over a 70% success rate, or if you like, a 30% failure rate, 5% worse than last week. Campaigners worry it's vulnerable groups that are missing out.
We know, for instance, that among Bangladeshi women over the age of 65, only 7% have English as a main language. Then it's absolutely fundamental, and it is a huge problem that we don't have a test, tracing and isolating system that doesn't converse with those people in a language that they're much more comfortable with.
Test and trace is our best defence against the second wave. Boris Johnson promised a world-beating scheme. With the lockdown easing very rapidly, it needs to improve as quickly as it can. Roland Manthorpe, Sky News.
Texas government Greg Abbott paused any further efforts to reopen the state on Thursday and ensure hospital beds are available for COVID-19 patients. Abbott's move came as its state, California and Florida, the three most popular, set record for new coronavirus cases daily amid fears of high number of cases in major Texas city if the trend continues. CNN with more details.
In the nation's three most populous states, things are going from bad to worse.
I don't think history is to look back forgivingly upon the United States and Americans for going down this road.
California, Florida, and Texas breaking records for new cases in a single day. Texas pausing its reopening to, quote, corral the spread of COVID-19. In the greater Houston area, Texas Medical Center's normal ICU capacity is just over 1,300 beds. They currently have 5 available.
We're running out of that time. The runway is short and our healthcare system is filling up, and we need to do everything we can as a community to fight this pandemic.
One of the best ways to fight COVID-19, wear a mask.
I think it's incredibly unfortunate that this has become so political.
There's no statewide mandate in Florida, where more than 5,000 cases were added Thursday.
It is scary here. Younger people are getting sick.
Face coverings are required in hard-hit Miami, where the mayor is now considering fines for anyone who ignores his order.
If we don't want to go backwards, the only option that we have right now is to order masks in public.
This afternoon, the CDC announcing the actual number of infected Americans could be 10 times higher, roughly 20 million people.
It's about 10 times more people have antibodies.
New concern for pregnant women. The CDC reporting they may be at higher risk for severe COVID-19 illness, especially Black and Hispanic women. The agency also noting more young people are being infected and obese Americans, not just the morbidly obese, are at higher risk. This as new hotspots describe a scene that sounds eerily similar to New York in late March.
We are exhausted, reusing PPE, doubling our drive-through capacity, doubling our respiratory capacity, and it isn't enough.
There is such a renewed focus in many ways on hospitalizations, on ICU admissions in California, where the number of new cases reported today is down from that high of more than 7,000 yesterday. It was still over 5,300, and that is a massive number in the state. Hospitalizations and ICU care there is also up, and Governor Newsom saying just a short time ago that he's watching those numbers very carefully. And if and when COVID patients begin to strain the resources in hospitals and specifically ICU beds, the governor says he will consider then pulling back the reopening in his state, Jake.
All right, Erica Hill in New York, thank you so much. Joining me now, CNN Chief Medical Correspondent Dr. Sanjay Gupta. Sanjay, I mean, all of this was not only predictable, it was predicted by you and other health experts on this show and others. Why do you think we're seeing such spikes in cases and hospitalizations in Florida, California, Texas, which really, to be honest, had different approaches to tackling the virus?
Yeah, I think that all of them, the thing that they do share in common, though, Jake, was none of them met these gating criteria that we talked about before they reopened. I mean, some closed sooner than others. Some have been more diligent about talking about masks. But look at these gating criteria. New COVID cases down for 14 days. Why is that? Because you can then take from what's called a mitigation phase, where you're just trying to slow things down, to containment, to saying, I'm going to get my arms around this virus. If you have the case numbers going down 14 days, you're much more likely to be able to do that. And the bottom line is put that in sufficient testing program in place. Can you get tested if you need to get tested or if you want to get tested? Everyone that wants to get tested can get tested. That's still not true no matter where you live in the country. And Jake, the whole country sort of started late. So no matter where you are, California or Florida or Texas, there was a lot more cases in these states than I think anybody realized before we started doing anything at all in terms of staying at home.
And we pointed out on this show and others that none of the states that were reopening had met those gating criteria, not one of them. Deaths are a lagging indicator, which means at first you see the cases, then you see the hospitalizations, then you see the deaths. Are you expecting to see a sharp increase in the death toll in the coming weeks?
We are going to see more deaths. I think there's no question just by seeing what's happening in the hospitals. I think there's a couple of points, though. One is that we have learned some lessons from the last couple of months, Jake. Ventilators, for example, may not be a great option for a lot of these patients because it doesn't seem to be associated with much improved mortality. We have a couple of medications that are in the mix now, including one that's more widely available, this dexamethasone, and obviously remdesivir, harder to get, but that could have an impact, a positive impact on mortality overall. I think the big issue, Jake, is really, if you look at what happened in Italy initially, why was mortality rate hovering around close to 10% at one point? It wasn't because the virus suddenly became more severe, it was because people couldn't get into the hospital and get the care. That's what I'm really worried about in places like Houston, specifically in Texas, in several places in Florida where my parents live. If the hospitals become too full, people will die unnecessarily. And that's going to obviously sad and tragic, but will also drive up the mortality rates.
And Sanjay, we're just looking at the chart there. There's 2.4 million total cases in the United States that we know of, confirmed cases. The CDC said today that their rough estimates are that there's actually 10 times as many cases than that. So 20 million because of asymptomatic carriers. That's stunning, and it also suggests that these individuals, if they're asymptomatic, are spreading the virus to some people who won't be asymptomatic.
That's right, and part of this, I mean, is a fundamental problem that we haven't been testing enough. I mean, I know I beat the drum on that every single time, and people are sick of hearing it. But these numbers wouldn't be nearly as high. These projections wouldn't be nearly as high if we had been testing aggressively early. There are now young people getting tested that couldn't get tested before, so that is accounting for some of what the CDC is saying. But there's no question you have a significant population out there that have no idea that they are carrying the virus in their bodies right now, that they are spreading the virus right now. They are walking around unmasked right now thinking they are totally fine, but they're actually giving the virus to other people right now. So these numbers are going to continue to go up despite, you know, the measures that we're talking about being put in place.
There's a biology professor at UMass Dartmouth who told CNN that younger people testing positive for coronavirus at a higher rate, which is what we're seeing now in some areas, is a, quote, smoldering fire that will soon hit vulnerable populations, whether they're parents or their grandparents or people that they work for. How should this change how younger people approach their interactions?
I think that the basics apply to everybody. I think that's the thing. I mean, there's good news and bad news here, Jake. The good news is that we've seen around the world that basic public health measures, including masks and physical distancing when you're out in public, make a huge difference. Not incremental, not insignificant, a huge difference. I mean, again, South Korea, they never went into lockdown. They have fewer than 300 people who have died. Their population's 50 million, so they're a smaller country, but you can do the math. It's a significant difference. So young people have to wear masks. They have to maintain the physically distance. They have to behave like they have the virus, and they probably have to be particularly careful if they've been in some high-risk activity. Like we were talking about the protests and talking about the rallies in Tulsa and in Arizona. Those were high-risk activities. People who attended those activities probably should quarantine themselves for 14 days after an activity like that, young or old. So, you know, the basics apply, but they just have to be applied uniformly.
Thank you for watching DBN News.